Jennifer Said here, and welcome to the It's All Public Health podcast. Today we will be discussing health communication and stigmatization. As we reflect on all the ways we've communicated health information and the audiences we've addressed, it would be difficult to not consider the number of times we, as health professionals, have conflated identity with health issues in a way that fostered or perpetuated stigma. I've invited Jennifer Williams, a health communication specialist, to discuss this topic and provide us with the tools necessary to communicate with audiences in an appropriate and effective way. As we discussed best practices, it was impossible to not explore culture, power dynamics, and the amplification of marginalized voices. I hope you find this energetic conversation insightful and useful. So today with me, we have Jennifer Williams, and I am so excited about this conversation that we're going to get into. But before we do, Jennifer, can you briefly introduce yourself?
Okay, hi, I'm Jennifer Williams. I'm a plain language subject matter expert in public health communications.
Thank you. So maybe that gave you some indication about what we're going to be talking about. And several months ago, well, more than several months at this point, when monkeypox was making its way and people were discussing it, what struck me was how it was being framed as a gay illness, right? And it made me think of the 4-H's of AIDS, like back in the day, I think in the 80s, where we were describing risk factors and we're using this framing of homosexuals, heroin users, hemophiliacs, and Haitians. And that always struck me as a Haitian American, first generation, this idea that we would attach something that can affect anyone to specific groups, either homosexuals or Haitians. And I'm not negating risk factors, but it kind of brought me back to that because of the issues around stigma. And when we want to engage in conversations around risk and disease, illness, all these types of things, how can we get the truth out there without perpetuating stigma? So I wanted to have a conversation with someone who is an expert around communication. And I was fortunate enough to be connected to Jennifer. And so I guess to open us up, how would you provide us with a brief understanding of what communication is, or however you'd like to start, just kind of thinking about what I just mentioned, but which would be a nice baseline for us?
Well, communication is a very broad understanding of how you talk to the public about any number of things. It can be marketing, it can be advertising, it can be with public health, it's how you discuss disease or health related issues, anything from, diabetes to how to live a healthier life, exercise, to, pandemics, monkeypox, COVID. It can be from, infographics, newsletters, emails, social media, the little things you pick up at the doctor's office that tells you, about different vaccines or different diseases or different things in the community that you can do to be healthier. Those are all public health communication tools. That's what kind of communications as a broad umbrella sort of is when it comes to communicating with the public. But public health as a communication bracket is sort of new. It hasn't been recognized very long. It sort of came into being in 1975. That's not a very long time, really, as far as communications go. And I don't think we even had textbooks for public health communications until 1984. And that was the year I was born. So that's when the first textbooks came out for public health communications, 1984. And then we didn't get our first journal for public health communications until 1990. So it's a brand new thing. They didn't even start doing real research on public health communications and how to do it better until the 2000s.
And yet at the same time, we've been communicating to the public since we've been here on this earth, right? Like
Right.
on how to live a healthy life. So that's very interesting that we're not seeing a formalized approach to standardizing like best practices and all of that until maybe I think you just said like the 70s, 80s. So it's very interesting. As an expert in communication, are there some things that really get you going as far as how we approach, because you want like that tension and balance, right? Like you want to make those who are more at risk aware, but you also want to be mindful of language and how we use language. So what does that look like?
Well, I think that you have to be careful in communication to acknowledge, okay, you have a risk factor. This is a risk factor right now. This population is most impacted. You should use that language. This population is most impacted, instead of saying, I'm going to put all the communication out there garnered just towards this population, because that increases stigma. And that is where they went wrong with monkeypox. Like, I'm not going to pussyfoot around that. There was a problem with how monkeypox was addressed, and now they're trying to reel that in and fix it. And that's because they increased stigma and they know it, because they geared everything towards gay men. I mean, let's just be real here. That's what they did. When they came out with all of their public health communications about monkeypox, they put it right out there towards gay men, and that increased stigma. And it's something everybody can get. And that really irked me, because immediately I thought, this is going to be a problem, because this stuff's going to spread like wildfire, because they're only gearing it towards gay men, instead of saying you have a heightened risk factor, but everybody can get this, which is what they should do. You should address the stigma first, and then you should give factual information and preventative information. That is how you combat stigma.
Yeah. And interestingly, like when we talk about the harm of using language like that, we have that component, the stigma of like making people feel like their identity is a problem. And then you have those who don't fit within that community who feel like, oh yeah, that's not a me problem. So I remember engaging in a text message about COVID-19, and we were just talking about and it's just when monkeypox just came out. I think there's some other things coming up, and we were just going over the list of all these emerging health issues. And my friend, who's a heterosexual man, cisgender, says, oh, but monkeypox, I mean, I'm not worried about that for obvious reasons. And I said, well, what are those obvious reasons? Because you should be worried. You're breathing, you're living, you're in the space of and humanity on the earth. You should be. And I was like, oh my goodness, to your point, there was so much of a concentration, right? And direction towards gay men, that anyone who didn't fit that thought, oh yeah, that's not a problem for me.
And I think that's where plain language comes in. With the public, you have to use very direct, very concise, and very plain language. Yeah. And if you don't, then you get confusion. That's a problem. And I think that is somewhere, that's where a lot of public health communications programs drop the ball in a way with their students, because I see a lot of jargon and medical terminology sometimes in public health communications with the public. And I'm like, they don't know what you're talking about. They don't know what you're talking about. And you're not being direct enough. You have to be very, very, very clear. You can't say things that aren't clear. Like with monkeypox, initially the CDC came out and they said something along the lines of, this can spread through towels and linens. And that's what they said. And I put on LinkedIn, this is incorrect. It needs to say that this can spread through items that have touched an infected person's rash. Items, period, items. Yeah. They've corrected that. I have friends that worked at the CDC and they saw my post. It has been corrected. because you have to be clear, because the public was seeing that and they thought, I'm not going to touch somebody's bed sheets in house that are infected. No, but you might touch something in a public place that they've touched. You might go to a club and dance with somebody right on top of them. That's contact. You can get it those ways, and that needs to be clear.
Absolutely. And you bring up something else, and I think I'm going to segue into grace, right? Like when we do get it wrong, how do we, first of all, I strongly believe in professional humility. I think, especially in this work that we're in, you have to be open to being criticized, taking the note. It hurts, it pinches, of course. But then, like, I think Gloria Steinem said, the truth will set you free, but first it'll piss you off, right? But and you get over that, right? And then you're like, wow, I'm gonna take that correction. So how do we make room to receive correction? And how do we go about implementing correction in a way that is appropriate? Do you have ideas and thoughts about that?
Well, I think first we have to recognize that the work we do is not about us. I think that if we internalize that first, that the work that we're doing is bigger than us, then any criticisms that we receive, it's not about us. It's about helping the public at large, doing our job better to help the public at large. Then I think that should take some of the sting out of it, right? Because it's to help people. So it's not about us. It's about helping us do our job better to help more people. And then I think really when we backpedal, first we have to be careful because we don't want to lose the public's trust, right? So you have to be honest that, okay, we got something wrong. You have to be careful about how you say we got something wrong, because the public will lose trust quickly. And then they don't want to believe anything that you have to say again. And that's a big problem. So sometimes you just have to switch tactics very quickly. Like what they're doing with monkeypox is just kind of switching tactics. They're not really acknowledging, hey, we got this wrong. They're just switching tactics and bringing in broader audiences. Like, everybody can get this. Now it's everybody can get this. Your dog can get this. You can give this to your pets. And that is one way to do it. That's one way to do it. Just switch tactics and not really formally acknowledge it. Another way is sometimes the science changes and you just have to acknowledge, we've learned more. The science has given us more information, and what we knew before is not correct now. That happens.
And Jennifer, don't you also think, I love those, and it made me also think about, who did you have at the table to begin with, right? As you were developing these communication materials or whatever it is. And I've been in, working at a overwhelmingly PWI, predominantly white institution. Sometimes we're making decisions for certain populations and you look around and you're like, wow, they're not represented here. And some things could have been caught. And if they are represented in the space, the onus is not on them to speak up and speak up. The onus is on us to make the space comfortable enough for everyone to share and feel valued. So I'm kind of going back and forth a little bit. So I love the ideas around how do we shift and make the change when we get something wrong. But also I think there has to be real intentionality around making sure we have everyone at the table.
Yes. I've noticed health equity is a problem, and health equity is something that I care deeply about. I'm a multiracial, bisexual, non-binary, disabled Jew. It's not. I find frequently that I'm not represented at the table in multiple ways, and sometimes when I speak up, I'm silenced. A lot of the time when I speak up, I'm silenced because people will say, well, you know, yeah, but I get a lot of yeah, but.
Hmm.
Or they think they know more than me when they're not part of the population. I don't
Yep.
know if you've experienced that,
Hmm.
but I've experienced a lot of that. I know more than you, and I'm like they act like they know more than me when they're not part of that group
Right.
at all. I'm like, what are you talking about?
Right.
Particular, like one example I can think of is the disabled community has for years told people use the word disabled, use the word disability. For years, we have told people this. Use the word. It's not a dirty word. Use the word. It takes away stigma if you just use the word.
Hmm.
And then we have health organizations, actual health organizations that are supposed to help disabled people, using the word handy capable
Or
and
differently abled, or I mean,
differently
there's so many.
abled.
Yeah.
And then when I, as a disabled person, I'm like, you should not use that word.
Mm.
Our groups have been telling you for years, don't use that word.
But what that speaks to is that even in this moment of people showing that they have good intentions, that voices that are consistently amplified continue to be amplified. So even if you are part of the group who has a hushed voice, and you're saying, no, I'm from there, right? And I'm telling you that this is not what we want, and to be hushed in that space speaks to the fact that no matter how many books, how many times you read How to Be an Anti-Racist, if it's not embedded in the culture and in the air that we're breathing, we will still experience that. And where are those conversations? So when we're able to not even question the idea, even the commercials I've been seeing about there's a new prep out for HIV AIDS prevention and protection. It's all images of people in homosexual relationships, as if HIV AIDS is something for the LGBTQ community plus to be concerned with. And it's just like, no, this is a people illness, right?
Oh yeah.
So it's just fascinating how the messages are out there, the workshops are happening, all these things are being done, but the day-to-day and the times to really demonstrate that we're actually taking it in, we're still back in the 80s, 70s, or wherever. So I don't know. I don't know if I kind of went off a little bit, but
No,
I
I
guess,
think,
yeah,
it's all about stigma. The
yeah,
handicap role is about stigma. That is about stigma. They're still stigmatizing people. It's not,
right.
the culture has to shift and the communications around things have to shift.
Mm-hmm.
And the
Mm-hmm.
organizations in charge of those communications, they have to shift. They need to
Yeah.
move forward.
And move forward hand in hand. And I always, I teach, and it's easy to fall into or align yourself with the hierarchy of academia, right? I'm the professor, you're the student, and I show up as the expert. And in all of my classes, I don't care if they're 19, 18, 20, whatever the age, it doesn't matter. I try my hardest to value the expertise they bring. Even though I stand here as your facilitator, I see the experts. I want you to bring in your lived experiences, the knowledge you've accumulated this whole time into this space. And if I'm wrong, tell me. I want you to tell me, because I don't get it right all the time. If I say something, or if I note something on your paper that isn't right, advocate, tell me that, confront me. And I value that. So, oh yeah, my point is, as we shift, because people think, oh yeah, there's a brown person in the seat and now we're diverse and we have space. No, it still may not be rooted in justice and in equity and in inclusion, right? Just because you filled your little box of having certain people, a mixture of people here. So as we do this work, not only are we checking in for, do we have groups represented, but are they valued? When we are talking about things as a Black woman, right, first generation, we're talking about things related to the immigrant experience as the child of immigrant experience and a Black person. I feel that my voice should be amplified. in that space. But does that happen? Like to your other point, like sometimes it doesn't. I'm shush. I'm present. Oh, you saw we had a Black person in the room, but my experience and what I offer is shushed, right? So being mindful of that, and the allies, the people who have the amplified voices, like stopping themselves and making room. That's another thing, making room for those who have lived. Wait, I want to hear what Jennifer has to say because I know she has lived experience, and we have to value what her input is way more than those of us who aren't even from this community. So I think it's going to take a lot of work as far as moving us along to put out better communication. And I really value like the input you've provided so far.
I would like to see more people value lived experience. I see a lot of closed off. You don't have the right degree. You don't have the right whatever. I'm not going to interview you. I'm not going to talk to you. I'm going to shut you up in a group meeting because I don't think that you have the right credentials for whatever. And that's not always true. I don't think people understand, income inequality or being a minority. There are lots of closed doors. And so people teach themselves a lot of the time, and they can learn a lot through lived experience and through teaching themselves, because if you grow up really poor, you do learn to teach yourself a lot. And so maybe they know more than you think they do. So maybe you should just and listen yourself and see what they bring to the table.
Yep. I do a lot of work with Main Initiatives, and they are a foundation that provides grants to immigrant-led organizations, BIPOC-led organizations, or organizations that are really focused focused on those communities. And they did something really powerful. They are all about philanthropy and really turning it upside down, because there's a lot of elitism in that, and it does tend to perpetuate that hierarchy in a lot of ways, when it's like we're the funder and you have to do what we say we want you to do. But two things that came to mind, two experiences that I've had with them. Number one, I was part of the pool who were reading their proposals for funding, and they were so specific about training us to look beyond maybe like little typos, like really remembering that a lot of these people, like you were talking about, the people who are doing the work, right? They may not have the staff, the money to get a grant writer, like these huge organizations. And so what happens is when you can afford a grant writer and you can afford someone to do that, I mean, do you really need this money, right? It's the person who's at that one person shop who's like, I'm in my community. These kids need a place to go. They need computer skills. They need this. They're bringing in community and help and really meeting needs, and may not have the writing skills. You know what I mean? They may not have like the time capacity to really like flesh out. So we were really trained to read beyond what we saw. Like, what's the true need here? Are they doing the work, right? But wouldn't want to spend the money. And I don't even want to say afford, but wouldn't want to spend the money on a grant writer, because that meant I don't give something that was so needed by this community because I'm taking money from there to do that, right? And I thought that was so interesting. And it made me think of organizations that aren't doing that. And it's just like giving money to the same people over and over again. And those grassroots who may just be an office of one, they're overlooked, right? So there's that I think is so interesting. And then the other part about amplifying lived experience, we got to a point where we had to vote on who should receive money. You have a finite amount of money and you can only grant maybe 15 organizations. And because we focus on immigrant-led organizations, BIPOC-led, Black, Indigenous, people of color-led organizations, Black, BIPOC individuals who were in the room voting, our vote counted as 5 votes. So we were amplified in that space because we brought in the lived experience, right? We brought in a perspective, right? I mean,
Yeah.
Main initiatives, they need to like share, and it was a process. It wasn't always like that. And Jennifer, I have to say, when I was given, like I was sitting next to a white person, they were given whatever, like, okay, 5 tickets, and I had like maybe whatever the times is. I can't do the math right now, but whatever. I felt awkward. First of all, you weren't presented. They didn't just say, oh, you're Black, here's your extra tickets. You had, I don't know, there was something, I know it sounds so trivial, but for me, it meant everything. The person giving the tickets held both. I had to choose the one that was more valuable in essence, right? And I felt weird. I felt weird stretching over to get more tickets. And I had to like sit with that, like, why did I feel awkward about being given more? Especially when I saw someone getting less next to me who was white. And I had to kind of work, and that's a whole other podcast and conversation. But I do think, I thought that was so powerful. Like, and when you are like you're mixed race, you're all of these different things, and you've been kind of marginalized your whole life in a lot of ways. And then to be like, no, you are the amplified voice in this space. It was really an interesting experience. And I valued that they saw the worth, not like, it didn't matter where you came from. No, it was, do you have lived experience, and can you speak to what we're doing and align, and vote based on that. It was just amazing. But anyway.
That is amazing.
Yeah. So how can we bring some of that, right? As we're creating, going back to our, the point of our conversation, how can we bring that into, how did they feel seeing all of these ads? How could we still reach you without stigmatizing you in the process, right? It's like, oh, we want to help these people, we're slapping them all along the way. It's like, no, like, how do we bring them into the space, amplify their voice so that communication is done well?
Well, first, I think we need to know our audience. I think that's so important. I think that you need to figure out who your audience is, and that'll depend on who you're working for, right? Like if you're trying to reach a national level audience, then that's going to be very different than if you're working for a rural community and you're trying to reach a rural audience in a very small town. And if you're working in a very rural small town that is, predominantly BIPOC or predominantly Indigenous versus predominantly white, those communications are all going to be very different.
Yeah.
They just are. And I don't want anybody hearing this and thinking, oh, that sounds racist. It's not racist. It is a communication strategy that's going to vary depending, it varies because people communicate very differently. And it varies. And so you need to know who you're communicating with. And I think that it's very important sometimes to try to send out, surveys and things to the public to find out what reaches them and how. And I don't think we do enough of that.
Yeah, I agree.
Like, if we're not asking the public what matters to you when we communicate to you, then how can we communicate with them better? Especially the marginalized groups.
Yep. I agree. And this is not something that it shouldn't be a reactive process. This should be embedded in the work that we do from the beginning, because I do get when things are emerging quickly, you have to, like taking extra time. But if we've already and that's the thing too, if we have relationship with individuals, right from the beginning, and we're engaging in this process, constantly checking in, like, how did you feel about that? How could that have been better? We can use that to inform other things that we have to do along the way. But when you start asking people and using people, and that's another thing too, right? Like using people for their time and not compensating people, but that's a whole other thing. But I think we missed that, like building relationship with community in a genuine way. Like, I'm working with you. I want to leverage the strengths that I see. I want to know what you think about this communication from this period. Like, how could that have been done better? Yeah. So I'm just saying, yes, amen and yes to what you just said.
Right.
And I guess we're getting kind of close to the end of our conversation.
Okay,
What are some, and I think we've shared some best practice, but what are some other things that you can think of when it comes to best practices for communication building?
well, I think you need to research what you're communicating about. You have to research that. You have to research your audience and know who your audience is. You have to, you need to use multiple avenues for communication,
Mm,
not just one, because people communicate in very different ways. So you don't want to just use one method. I think that's very important. If you're only using one way to communicate, then you're going to miss a whole group of people, multiple groups of people. So for instance, if you're only using written word, some people may not be able to read that well.
mm-hmm.
That's just factual. So you may need to take out a radio ad. You may need to do a TikTok video. You may need to, yes, do a TikTok video. That's what I said. You may need to leverage social media in different ways to reach those people who don't read very well.
Yeah.
You need to consider how to reach people who don't speak English. You need to
Yep.
consider how to reach people who are blind or deaf. You need to use alt text when you use visuals. You have to take those things into consideration. And you do need to use visual aids. You absolutely do need to use visual aids in some communications. So what I'm saying is branch out. Don't just
Yep.
do one thing and think that you've done enough.
Mm-hmm. And I also, if I may add, knowing who people trust and recognizing that sometimes they're not the best person to get the word out, right? Like
Yes.
I remember during COVID and just coming from a Caribbean background, and I'm not attaching like negative or positive, but WhatsApp was a source for like a certain group of people in my family. Well, I saw on WhatsApp, you make this steam thing and you make this and you make that. And it's not about like saying no to what they believe culturally, but then adding like, wow, that sounds like such a relief, right? Like if you're feeling this way and you do this, but
Yes.
think about this as well. Think about this as an added protection and really paying attention to who people trust, like, especially, coming from a Haitian background, very Protestant background, the pastors, right? The older adults in the church and how they were
Yes.
valued, and knowing that is very important, like understanding who
Yes.
people trust in community. And that comes from the relationships you build.
Right. And forming community partnerships to
Yep.
get the word out. That is important. That is vital.
Community partnership. Yeah. And finding champions is, yeah, that's a great one as well. So as we come to the end of the hour, kind almost, what are some other thoughts you have around stigma or inaccurate conflation, right? Like this idea of like attaching this illness to this specific group of people when it's a people thing, period. So are there any thoughts or other final,
Um,
considerations?
I just think that we have to be aware. Sometimes we're not the ones attaching it, right?
Mm,
Sometimes the public does that. And we have to pay attention to see what the public is doing because sometimes we don't attach the stigma, the public does it
mm,
because misinformation gets spun by like conspiracy groups and, just social media out there. And we have to combat that, right?
yeah.
So, for instance, with vaccines, the
Mhm.
whole anti-vax movement, we didn't do that.
Right, right.
um, we have to figure out how to combat that. So you have to be aware of what's going on in the public so that you know what misinformation you have to address in communications.
Yeah.
I think that's very important to consider as well, that you have
Hmm.
to pay attention to what messaging is out there that the public is sending out on their own and is taking hold so
Yes.
that you can start addressing it before it becomes really problematic.
Yeah, we didn't talk about that, right? Like we have this one role of putting clear, simple, accurate information But then we also have this other job of being aware of what's already existing. What's the baseline of the community as far as like the interpretation of the illness? Are they conflating certain things or interpreting certain things in a way, or just hearing dis and misinformation, right? So
Right.
that is so important. We have a lot of work to do. Our team has to be on it.
Yes, we do. We do.
Yeah, we have a lot to do because
It's a hard job,
communication is everything. Yeah, yeah,
but it's worth it.
it is. There's nothing like doing the work, working community, being focused on centering relationship, and then seeing people understand. And it could be like, sometimes it's just, I was listening to, maybe this was like an example someone shared, maybe on Twitter, of being in a cab speaking. I think she's Black as well, and having a cab driver who was Black, and the cab driver just like kind of share. I think she was in like the medical field, and talking about targeting Black people for the vaccine and what that meant to that cab driver, how he interpreted that communication. For us, we tend to use that, oh, we target this group, but in reality, we're really saying we're prioritizing, right? That's really the synonym there. But he's like, well, why are they targeting us, right? Why can't they give me what they're giving the white people? Why are they giving me something special as a Black
Oh my
person?
gosh.
Right? Like, why are we because when you think about target, you think about
That
like
does sound
shooting.
negative.
Yeah, you think, I
Yeah.
shouldn't say that, but you think about like, yeah, like something
Yeah.
kind of negative, even though we're so accustomed to using it in the way that we use it in our work. And it's just like,
I
wow,
never would have considered it jargon, but it is.
yeah,
It's a kind of jargon.
right. And it's right, exactly, because it's so embedded in our world, in our public health world. And that's an example of someone making space for that person to share that, and then to say, oh, this is what we actually mean. And then we have to go back and do the work and say, okay, we probably shouldn't be using the word targeting this group over that group anymore. But yeah, I think it's all so very fascinating. And I really appreciate this conversation. There's so many elements that we could have dug into. But I thank you so much, Jennifer. Is there anything else? I don't want to put you on the spot again for last final words, but
No, I can't think of anything else, but I've really enjoyed this. It's been wonderful.
it has been. And I appreciate your time so very much. And to our listeners, we thank you so much for taking the time to spending a little time with us to hear our candid conversation about communications. And Jennifer Williams, thank you. And I hope we have another one of these discussions again.